Hey, Mary.
Hi there.
I'm Becca. I know you scheduled a meeting for today about Factor 5 and some of the test results that you got.
Yes.
How have you been doing?
Doing okay.
Doing okay?
Yeah.
I know you've had a lot going on the past month and a half or so, right?
Very crazy hectic.
Yes. It's hard to be in the hospital and they start doing a lot of testing and you're not quite sure what it means, and so I'm really happy that you came in today so we could talk more about it. So can you tell me a little bit about what happened?
So I went on a trip, and it was like a 9-hour flight. Took like multiple just transportations. I guess I was probably in a position maybe for too long. When I got home, I found out I developed a blood clot, or DVT, and I've been on birth control for a year, and they have since found out, taken me off of that. And then I knew, kind of looking into further history, that my grandmother actually had an issue with kind of clotting too.
Was that during when she was having babies, or
yes,
was it
during when she was having kids? So I got genetically tested to find out, and I do match the same as her. So it's kind of a shock, and I've been thinking about having kids, so it's kind of tough.
Yeah, it seems like you may be a little fearful, may have a little bit of anxiety. Okay. Sometimes I like to just name that so that we can just talk about it and talk about the implications from the testing and what you're worried about. So I guess, can I ask you, what are you worried about?
Just if I want to have kids, obviously having a clotting issue is a big risk. Just want to know how it's going to affect during carrying a child and what it's going to be like for my child. Just anything to kind of ease the anxiety would be helpful.
Okay, good. So I'm going to start right there. So what they went ahead and tested you for after you had that DVT in your leg was what's called Factor 5. So I know you've probably heard that, and that's kind of yes,
new term.
So they quickly tested you, I would think, because you had the clotting issue yourself and they couldn't really find one clear answer, and then you found out that family members had similar issues.
Right.
So that's typically when the only time that they actually test for Factor 5 is when there are multiple risk factors. And that's what happened in your case. Most of the time we don't recommend getting tested for it because it's really a small chance that you're actually going to have blood clots.
Okay.
And in your situation, they can't really say that it was Factor 5 that caused the blood clot. It could have been how stationary you were, sitting for so long. It could have been, your body's response to the birth control pills that you were on. It was kind of a newer thing as well. It could have been dehydration could have factored into that. All things that cause blood clots. So with Factor 5, what your test result said is that you have one copy of what we call the mutated gene. Now, it doesn't mean you're a mutant or anything like that. So don't worry about that. Factor 5 is actually something that it's really only if you have the clots are they going to treat for it. So you're probably, were you given any medications, like a blood thinner?
I believe so.
Yeah.
If I remember right, yes. The painful shots.
Yes,
Yeah.
the Lovenox shots you may have had in your abdomen while you're in the hospital, and now they've got you probably on a pill that's keeping your blood from getting too sticky and causing those clots. So your risk at having one copy is 3 to 8 in 1,000 people that you'd actually get clots. So that's why it's still really low. If you were to have 2 copies, like we actually found out, we were able to find out your grandmother Eve, right?
Yeah.
We put together this kind of family chart to show you just about how Factor 5 has kind of been passed on in your family. And Eve actually had 2 copies.
Okay.
So she may have had more issues because when you have 2 copies of that mutated gene, your risk actually goes to 80 people in 1,000. So it jumps up there quite a bit. But for you, you're still at that 3 to 8 in 1,000. Yes, you have the 1 copy. So what you're doing for treatment is already what would be suggested, since you already had blood clots. If you hadn't had one, you probably wouldn't even know it, that you had Factor 5. They would never have thought to test you, even with your grandmother's history. They wouldn't have done that.
Really? It's kind of scary because during childbirth something could have happened and I could have glad to know.
But that's actually the good part about this
in a weird way.
Yeah, and is that they still would treat it the same. They're still gonna watch you the same. They're not even, your doctor's probably gonna teach you about medications, and they probably won't even put you on something to start. They'll just monitor you.
Okay.
And if you were to start to have, signs of DVTs, which we'll go over in a second, then they may prescribe one of those blood thinners to you again. But really, it's something that people talk about, even going back and forth, whether they need to be tested or not, because the treatment really doesn't vary unless you've already had those blood clots. So I hope you're getting a little less
Yes.
scared about this.
Yes.
Okay.
Yes.
So, and it looks like the notes from your doctor say that they're actually gonna stop the blood thinner and they're gonna put you on a baby aspirin, which is
Okay.
just, baby aspirin is just
I'll
kind
take
of
a pill over a shot any day.
right. And they've probably already told you, I see in the notes, that you're just not gonna take those oral contraceptive, the birth control pill again.
Yeah.
And if you're interested in other options, which it looks like here you filled out and said that you're interested in having children,
Yeah.
so you probably won't be
Good for now.
utilizing those as well. So this is something that's kind of hard to understand, and I pointed out for your grandmother the pedigree chart,
Mhm.
but this just shows how your parents, so it looks like your father had one copy of the gene as well,
Okay.
and now you also have that. Your mother did not have, and so there's a lot of big words for this,
Mm.
but we do the chart so that it's easier for people to understand it. So you can see your brothers and sisters here. Your brother here, he elected to get tested, which is fine.
Mhm.
It's okay to know. So he'll now know that he has one copy as well.
And he could pass it on too.
And he
to
could
his
pass it on
kids.
as well. But really, again, the chances are very few that you actually have the blood clots
Okay.
and that it becomes a problem in life.
Okay, so you could actually have it, but not actually present with any blood clots.
And we
technically.
wouldn't, and if you were to have children, we wouldn't even suggest that they have the testing to see
Okay.
if they have one or two copies. We would really only say, if they were to start to have an issue or signs and symptoms of a blood clot, then we would have you test. So this is the important information I wanna make
Okay.
sure you take home. So this is a great chart about how to assess when you might need to take some action on a possible blood clot. So I don't wanna go over everything today. I really would like, if you're comfortable, to read this,
Mhm.
and then come back and have questions for us, or bring it to your doctor's office and talk to them about it further.
Okay.
The other thing I wanted to give you is this packet here. And this is really for all patients and families that have been diagnosed with Factor V. And this is a great packet with tons of information about some of the statistics that I went over today, some of the concerns that you have. It talks about how other people have had those concerns, and some other things that we talked about to lessen your anxiety.
Mhm.
They're also here. There's some great information about how it's passed on with those larger words that I was talking
Yeah.
about. And, if your partner, if they decided to get tested, if they have two copies or one copy, and what that
Say
would
if
mean.
my husband is tested and finds out he has it as well, is there an increased risk for having kids even more so?
No, it's not gonna affect your ability to have kids,
Okay.
because you
But
have
the
one
kid's
copy.
Offspring, if there's, my husband also has it and I have it,
Mhm.
is there an increased more risk of something happening to them?
It's still,
Still the
if
same.
they were to get two copies, then it's that 80 and
Okay.
1,000.
Okay.
But they still don't recommend testing.
Okay.
It's more fear
Then
that you
anything.
don't really need.
Okay.
It's really, if you have a sign or a symptom for the blood clot, then that's when they might get tested, because there is a family history as well.
Right.
So it talks about that as well. And at the back of the packet, it also gives some great community resources on how to prevent blood clots for anyone.
Okay.
Anyone sitting on a plane for 9.5 hours is at risk for a blood clot.
Yeah.
So it really can happen to anyone. And so that's right here. And this is just another good chart about preventing, a really easy way to remember it. And it sounds like a lot of the lifestyle choices you already make, you're pretty active. Yeah. And you reported that you drink a lot of water and that you don't generally sit down for 9.5 hours at a time. And, you know, you're looking to have kids and everything else is kind of, you put pretty good, right?
Goes smooth, yeah.
So this is a lot to take in.
Yeah.
Or do you have any additional questions?
Not right off the top of my head, but if I think of anything, I can call you or
Yes.
talk to my doctor.
My phone number is right on the front of this packet.
Okay.
And our office, and if I'm not here, you know, other people can answer your questions and apply as well. And again, if you wanna come back in and read the information, if you still have questions or you're concerned, you can come back here, or your primary care doctor or physician would be helpful as well,
Okay.
if you're still worried.
Thank you. Very helpful.
All right.
Thank you.
Thank you so much for coming.
Nice to meet you.
Nice to meet you. And good luck.
Thank you.